Do you wish you could turn back the clock on aging? Anti-Factor Lipids is the breakthrough supplement that's scientifically proven to repair and renew your body's cells. Anti-Factor Lipids are identical to the phospholipids found in your cellular membranes. They've been shown to repair mitochondrial damage, a primary cause of biological aging. Anti-Factor has also been shown to reduce fatigue by more than 40%. And it's even been shown to significantly reduce a wide range of symptoms and improve the quality of life in patients with various conditions like chronic fatigue and those undergoing chemotherapy. I've been using Anti-Factor for years. I don't go a day without it. Anti-Factor Lipids comes in an easy-to-use powder in 2 convenient sizes. For more information and to order, just call 800-982-9158, 800-982-9158, or go to ntfactor.com. That's ntfactor.com for Anti-Factor Lipids powder. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. We're going to continue our discussion of sleep with Dr. Jacob Teitelbaum. He is the author of From Fatigue to Fantastic, a classic book on treating chronic fatigue syndrome and fibromyalgia, newly updated. And he also has a new book coming out on pain. Is the book called A Real Pain?
No, there's going to be Pain, Go Away, but that got taken. So the name of the book is Pain Relief.
Okay.
And then the subtitle, In 4 Easy Steps. It'll be out March 23rd.
Oh, fantastic. And then we'll circle back and we'll interview you on the subject of pain, because that's such an important topic. I think it's, universal experience of man and womankind. Okay, good stuff. So we're about to talk about, kind of nail down the subject of what to do to help people fall asleep and to remove impediments to falling asleep. But we got to talk about middle of the night wake up. So we mentioned blood sugar as a contributor. We mentioned, restless leg syndrome. We mentioned, some of these interfering factors. Sleep apnea, I think, is one. But what can you do when you wake up and it's 3 a.m. and you only have to wake up at 6:30, and you don't want to take something sedating because you don't want to feel hungover. You don't want to take an Ambien, at 3:30 in the morning because you'll forget what country you're in.
For those who are taking Ambien, I know this is a natural show, but I tend to integrate the rest. The regular ones that are the pills and not sustained release, you can take 2 milligrams, 1 to 2 milligrams. If you take it some at bedtime, people will take just 1 to 2 milligrams, just a tiny bit of it, leave it at their bedside table.
Okay.
As long as it's at least 3 hours before you're getting up to go and drive and stuff like that. Crush it between your front teeth, stick it under your tongue. It will put you back to sleep very quickly because your Ambien level's not gone. It's just dipped below sleep level threshold. So it just takes a tiny bit to bring you back up, but that's not enough to leave you hungover. But a much better way.
So, but by the way, just what I like about you is, as a physician, trained conventionally, when to hold and when to employ some of these conventional remedies, and you employ them kind of strategically and innovatively, like use a little bit of this, or this is an old medication we've forgotten about, and how about that? And, sometimes you really do need, for serious problems, you need a little bit of, pharmaceutical intervention. So anyway, go ahead. I'm sorry.
Yeah, I'm not against medications. I'm just against the way they're used in this country, which is based on profit rather than based on sanity, health, or science. To say that it's, how do they call medical education has been described as slick pharmaceutical advertising masquerading as science. And that was by one of the New England Journal of Medicine editors that I'm quoting from for continuing medical education.
She quit in utter frustration. Mm-hmm.
Yeah, and Marcia Angel was another one who was equally unhappy with it. So the natural remedies are incredibly powerful and simple common sense tricks. So if you wake up in the middle of the night, we talked about having a bedtime protein snack, 1 or 2 ounces of protein, to maintain blood sugars during the night. Another common cause of middle of the night waking is acid reflux.
Okay.
Because during the day, we're upright and gravity keeps the acid in our stomach. But especially if you put on a little weight, the valve, the one-way door that things go down your food pipe and into the stomach, and then the stomach acid stays there, leaks. So when we lie down, gravity's not in our favor, and acid can reflux up into the food pipe. And a simple way to test for that is for 2, 3 nights. If you wake up routinely on most nights, take 20 to 40 milligrams of Pepsid. And I know that we'll talk about the natural ways to deal with
Hmm.
it in a minute, but for a test, it's really
Okay.
reasonable to do that for 3 days.
Okay.
And if you find that you don't keep waking up in the middle of the night, or it's much less,
Mm.
then you know that the acid reflux is contributing.
So it's a
And
diagnostic trial of this medication. It's not like putting
just
you
so,
on it in perpetuity.
no. So what do you do if you go, oh my God, well, that's it. Okay, don't eat except for your protein snack that close to bedtime. Give yourself time to digest. Use a plant-based digestive enzyme with dinner so to digest more quickly. But what I recommend is just half a teaspoon of baking soda, Arm& and Hammer baking soda,
Hmm.
in 4 ounces of water, and stir it up right before you go to bed, and chug it.
Hmm.
It's going to be alkaline, so chug it, and then take a couple ounces of fresh water to wash down the alkaline. You'll find the bigger your burp, the more stomach acid you had
Hmm.
in there,
Interesting.
and the it will keep the stomach acid gone and give you a 4 hour head start before it reaccumulates during the night. For those of you who don't want that much salt, I mean, I do this myself, and I use potassium
Okay.
bicarbonate,
Okay.
and
Yeah.
especially for
So if you
those
have
with
high
high blood
blood
pressure
pressure, yeah. Okay.
issues. And this will give 1,000 milligrams of potassium in addition. So,
Yeah.
but it's the potassium bicarbonate food grade. You can get it on Amazon.
Hmm.
Half a teaspoon, 4 ounces of water,
Wow.
chug, swallow, rinse and swallow after that. Um, Big difference. And then gravity. If you can raise the head of your bed, pillows don't work because they'll just raise your neck, and that doesn't keep acid in your stomach. You want from the waist up, you want your
Uh-huh.
body
Uh-huh.
uh, at about a 20, 30 degree angle even. So you can put a couple, I say phone books, oh my God, talk about anachronism, a couple bricks under the head
Yeah.
of the bed, the legs at the head of the bed to raise it up. But there's all kinds of ways of using
Yeah.
pillows.
Yeah.
There are wedge pillows
Hmm.
made specifically for this. Uh, Hammock or Slimmer has a nice pillow wedge. They're easy to find. And that puts gravity back in your favor and helps you sleep.
Indeed. Those are good suggestions. Uh, do do you differentiate between the things that you take in the middle of the night versus the things you take prior to bed in terms of, one is more suitable for that time?
Yeah, again, to me, the chamomile tea, which I leave at my bedside
Hmm.
during the night,
Hmm.
and a little bit of the CBD or hemp. I like the whole hemp oil. I prefer
Hmm.
that with maybe 15 to 20 milligrams of CBD. It's not enough to leave you hungover
Hmm.
if you have at least 3 hours of sleep left. Um, but you'll find it's not as hard to go back to sleep if you're not worried about going back to sleep.
Okay. Yeah. That's how it
It's
works.
a funny thing.
Yeah.
So you'll find these little simple things. You roll over, and even if you're not all the way asleep, it's okay. Just put yourself in a calm space
Hmm.
and just let your body rest. You'll drift back into sleep.
Yeah.
Um, Other common things, prostate enlargement, that's maybe a little beyond the
Sure.
show here.
Yeah.
But waking up with night sweats, with the things we talked about trigger night
Check
sweats.
out the potential of getting hormone replacement therapy, to deepen your sleep. And by the way, I think men benefit from testosterone to deepen their sleep. So a sign
Yes,
in a man that their sleep quality is deteriorating, it could be a sign of low T. No?
yes, absolutely. Because one, the low testosterone will cause low energy, but it also causes insulin resistance, increases pain.
Hmm.
And it's worth a moment to talk about when pain impacts sleep.
Hmm.
And because there's simple measures you can do to help, and there's a supplement called Curamin that will, taken at bedtime, can really keep 1 or 2 tablets, can really keep the pain at bay so you can sleep and it doesn't wake you up. Um, but again, for those, it's beyond the scope of this show. Can I give my email address where people can
Please.
ask for
Yeah, give it up.
information
Yeah.
sheets? So my email address is fatigue, FATIGUE, DOC at gmail.com.
Fatigue
And you
doc.
can ask, Mhm. And if you have nerve pain, if you've got chronic pain, if you've got fibromyalgia pain, if you've got many of these different kinds of things, you can email me and ask for free information sheets. You can give the main topics, diabetes, whatever you're dealing with, heart disease. And for many of these, I'll just send you the free information sheet to kind of says here's what to do if I have those sheets on
This
those
is like an
sleeps.
old-fashioned radio show. I don't know if you remember Carlton Fredericks, but he was a radio pioneer, and he used to employ an entire room full of women. It was always women who would respond to the mailbags full of send a self-addressed stamped envelope to, and this is before the era of the internet, and they would they had these shelves where they had printouts for every condition known to man, and they would fold them up nicely, put them in the self-addressed stamped envelope, and send them back to listeners. But it required a team of a couple of dozen women to. But now with modern methods, we can do it much faster. One of the things that I have found a real boon to, especially middle-aged women, women like 45, 52, around that age, maybe they're not ready for hormone replacement therapy, is progesterone. Are you a fan of progesterone? Has a very interesting effect on perimenopausal women when it comes to sleep. Yes?
It's like our body's natural Valium, basically,
Yeah.
except without the addiction and the toxicity.
Mm-hmm.
So the other thing is that it's very versatile, and the range of dosing varies quite a bit. So key things, it needs to be the bioidentical progesterone.
Right.
I will not use Provera.
Micronized progesterone. Right. Yeah.
Mm-hmm. So you can get that compounded, and
Mm-hmm.
for most of the women, what I'll do once they're reaching perimenopause, I think it's really healthy. If I was a woman myself and I
Mm-hmm.
was starting to go through
Yep.
perimenopause,
Mm-hmm.
I'd be on a vaginal compounded cream with the biased with 30 milligrams of progesterone and 1/2 milligram of testosterone, period, unless
Right.
I had PCOS. Um, and I would just be using that because I think aging is really optional.
Yeah.
And the cream helps us sleep. It helps stay younger. It's healthy. Um, it'll decrease the night flashes. And in men, low testosterone is a major cause of diabetes, high blood pressure, high cholesterol, uh, premature death. It does not increase cancer risk unless somebody
Mm-hmm.
has prostate
Mm-hmm.
cancer, at least in my reading of literature. It improves energy, decreases depression. Uh, I think the testosterone when men go through menopause
Yeah.
using, but again, not the shots, just either the pellets or the bioidentical
Yeah.
cream. I prefer the pellets. I think pellets are good for one because they're stable,
Interesting.
steady release. I think these things are very healthy. I mean,
Yeah.
we're built for planned obsolescence,
Yes.
but, but maybe we don't want to get old before we go.
Indeed. And when it comes to testosterone, I think one of the strongest pieces of evidence that testosterone is beneficial for sleep is what happens to men who get ADT, androgen deprivation therapy for prostate cancer. They get hot flashes like women. It destroys their sleep quality. They're killing their testosterone. Unfortunately, that's necessary for, that phase of treatment of advanced prostate cancer. But I think it really kind of proves the point. Okay, so let's talk a little bit about pharmacology. And, I think we have to acknowledge that in some cases, people need, all the natural things in the world, valerian, you name it, may not do the trick for them. So we want the light touch with pharmacology. We want to be selective. We don't want to give people addictive things. We don't want to give people things that will make their risk of falls greater, because that's another thing, right? Or that will accelerate cognitive decline. But I don't think people should be mortally afraid of taking something that will reset their sleep cycle and maybe is a bridge towards better sleep patterns, shall we say. Not maybe a permanent thing.
Yeah. I mean, sleep hygiene is good. The natural options are good, but they're not enough for everybody. People who have their sleep centers broken, the hypothalamus is important. You can give them all the natural stuff you want. They're not going to get the sleep most of the time. They will need the medication sleep aids. Now, for falling asleep, I know Ambien gets a lot of a bad rap and stuff like
Mm-hmm.
that, but it can be helpful. It can be addictive, usually over 10 milligrams a day. You don't want to stop it suddenly after you've been on it for months because you won't sleep for 2 weeks. It needs to be tapered. Some of you who take it will sleepwalk, sleep eat. You rarely even sleep drive. If you
Oh,
notice yourself walking around in your sleep and then you maybe shouldn't use it, or put the keys somewhere. Ask your wife or husband to put the car keys somewhere. Going in, you know, being in the middle of the night and you wake up in the morning and the ice cream container is empty is not as bad as like waking up in the middle of an emergency room and driving.
Wow.
Um, but it can be versatile in that way. But other medications, you don't see the addictive risk, but the key to avoid next day side effects or uh, dementia or falling is tiny dosing is all you need.
Mm-hmm.
So things like trazodone, they give 300 to 450
Mm-hmm.
milligrams a day for
That
depression.
was one of my go-tos. Yeah.
Yeah, I don't use it for depression. I think it doesn't work very well in my experience with that. But I will give 25 to 50 milligrams.
Yeah.
And again, you try these things, and most of these things you're going to know in the
When
first
the
2 to 3
depression
nights.
dose is more like 100, 200, 300. Yeah.
300 to 450,
Right. Okay. Mm-hmm.
which is insane.
Yeah.
So 25 to 50 for sleep. Elavol or amitriptyline, 10 to 25, especially if somebody has pain, especially
Mm-hmm.
if they have pelvic pain,
Mm.
or if they have neuropathic pain.
Mm-hmm.
If they have those kind of pains, I'm going to start them on gabapentin, 100 to 600 milligrams at bedtime, and plus amitriptyline, the Elavol, 10
Mm-hmm.
to 25 milligrams at bedtime. Um, and that's enough for most people.
Cinequan, do
Uh,
you like Cinequan?
Cinequan is helpful if you get the sedation
Mm-hmm.
from the Elavil, and it's a very, very good medication for sleep. Again, low dose,
Okay.
and they have the Cinequan liquid where you can even do it in milligram or less
So you have to get that
dosing.
from a
It's
compounding pharmacy, or is that a children's
no,
dose? It's a children's dose. In other words, pediatric.
it's just a liquid that
Oh,
comes that
okay.
way.
All right. All right.
Um, and it just because when next day sedation is a problem from
Yeah.
medication, the doxepin, and the Cinequans, these are good things to be going with.
Yeah. Interesting. Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share a message with you. So here goes. Listen up.
Have you ever heard someone say that probiotics didn't work for them? Since all probiotics are not the same, the probiotic you choose can make the difference between superior results and no results. Look for an enriched formula containing these 3 key components for best results: probiotics, prebiotics, and postbiotics. A worldwide leader in microbiome health for over 40 years, Dr. Ohhira's Probiotics is an enriched full-spectrum probiotic system fermenting multiple strains of probiotic bacteria and nourishing prebiotics. The result? Transformative postbiotic metabolites that maintain and support the biodiversity of flora in your gut for optimal digestion, gut-brain, and immune health. Dr. Ohhira's, certified vegetarian, free of gluten, allergens, dairy, and GMOs. Get Dr. Ohhira's probiotics today at Sprouts, Natural Grocers, Whole Foods, and other natural health retailers nationwide.
Thanks for listening, and thanks for supporting our sponsors. They're what make intelligent medicine a continuing free resource to you. And now, back to today's guest, Dr. Jacob Teitelbaum. You know, people always ask me, and it frustrates me, they ask me, what should I take to sleep better? And it's always it's emphasis of what can be encapsulated in a pill, whether a natural thing or a pharmaceutical thing. And my answer is that sleep is, it's a comprehensive lifestyle approach, as you have elucidated. But one element of that, and I always find that this is helpful, is something called CBTI, Cognitive Behavioral Therapy for Insomnia. And there are online programs, where you can kind of do it DIY, but you can also do it with experienced therapists. You can now do it remotely, so you don't have to travel to a sleep center. What's your take on that? Because I think that can be valuable because they teach you techniques to help you get out of a rut.
CBT, the cognitive behavioral therapy, it's wonderful and it's evil, depending on how and who's using it.
Okay.
I like subtlety, so what can I say? It's
Yep.
for most things, when it's teaching you to adapt to illness and conditions
Mhm.
and coping strategies, as it's used for sleep, it's
Yeah.
brilliant.
Right.
When it's used to convince you that you are nuts and there's nothing wrong with you and to gaslight you about an illness, as it's used in fibromyalgia.
Right. Or
It's-
chronic fatigue
it's-
syndrome. It's like
Chronic-
chronic
yeah.
CBT for chronic fatigue syndrome is like, kind of like just adjust to it, you don't get too perturbed about it, kind of thing.
Goes beyond that. It's as if you had CBT for cancer where the CBT person went in and said, "Yeah, there's nothing wrong with you," and convinced your family that you were just crazy.
Yeah. Okay.
It's abusive. But
Okay.
otherwise, the CBT is brilliant and it can be
Yeah.
very helpful.
Yeah.
But one of my favorite things, a simple way to get deeper sleep and fall asleep quicker is sex. Now, that's not sex, it's socks. So, wearing a warm pair of socks has been shown in the
Socks. Okay.
research
Got it.
to help you fall asleep easier and stay asleep.
Interesting.
Sex also can help, but it tends for
Right.
the guys to put them asleep and the women are wide awake. But anyway, it's just, so it varies. But the socks can help. And again, if you have a pain during the night, have you ever had a baby who's crying? What do? You swaddle them. You put them in swaddling clothes.
Heavy blankets. Yeah.
Bingo.
Yeah. Yeah.
It helps the pain and it settles down the nervous system.
Hmm.
It's kind of anxious, irritable. So
This is
online,
very evolutionarily conserved, in lower species. For example, when your dog is afraid of the thunder, is like put them under like one of those heavy blankets. It's very calming. It's part of a yoga technique. Is that at the end sometimes of a yoga session, you have a quiet moment where you're under a heavy blanket and you do relaxed breathing. Very therapeutic. Of course, that also requires a cooler room, right? Because you can't do that, in the middle of the summer when the air conditioner breaks down.
hmm yeah, and you're going to be in deeper sleep. Again, 60 to 67 degrees is optimal for those under 50 to 65, and you can make it a bit warmer for that as you get older or if you have pain. All these things help. And this is a menu to choose
Hmm.
from, not
Right.
a list of you've got to do these things.
Hmm.
These are things to try to see what works for you. But I'm like to wrap it up with a simple thing, which is that we live in, how do they say in Tale of Two Cities? It was the best of times, it was the worst of times.
Hmm.
We live in a world that's
Yeah.
remarkable and, as one would expect, also has a lot of challenges. There's an enormous amount of information coming in, and we haven't really been taught as a society discernment. We know if we're eating food, we know what we like and we know what we don't like. We know what makes us feel good, we know what doesn't. Now, the food industry fuels us with addictive foods, but naturally we tend to know. And as information comes in, as relationships come in, as different things, start to notice the things that feel good to you, that leave you feeling better, and that work. And the things that leave you angry, anxious, hateful, um, these kind of things, start to disconnect from
Yeah.
that. Your
Hmm.
sleep will improve, your health will improve, and your joy will improve. And again, as I mentioned earlier, you won't be uninformed. You will simply be less misinformed,
Okay.
and
I
you'll
think
be
that's an
happier.
important message. No, I think that, look, I mean, that stress levels are through the roof and everything's about engagement. They're all about getting you hooked. And that also makes money. And so, resist, be informed to the extent that it's either entertaining for you. I'm a student of history. I find it fascinating. Student of
Mhm.
politics to some extent. I find it fascinating. But do not let it color your daily experience because in some ways it is superficial and not real. So I just want to switch gears because I am planning a big trip. Next week, I'm headed for New Zealand. I understand that the time difference is 18 hours. In the course of an 18-hour plane flight from JFK to Auckland, New Zealand, nonstop, I will traverse the United States, traverse the Pacific, and end up in 2 days later in a different
Yes.
place. It's going to be
Mhm.
very disoriented. Now, you, I understand, are also kind of a world traveler because you have a kid in Berlin, right? And you live in Hawaii. So that's a pretty long trip. So, what are your secrets for uh, maintaining your circadian rhythm or reestablishing it when you're changing time zones like that?
Yeah, 12 hours for me is a short flight living in Hawaii. And going to New Zealand and Australia, those are long flights. We did that. So here's a couple tricks. in some ways it's a little easier because you're about 18 hours difference. Um, but it's for the couple days before, especially the day before, I will start switching my mind to the time zone
Mm-hmm.
that I'm going to.
Hmm.
I will start taking melatonin at about 8 p.m., 9 p.m. Uh, in the time zone that I'm going to. And
Okay.
then I will do that on the plane. During the plane, I will set my watch, unless there's connecting flights. I set my watch whatever the next connecting city is,
Mm-hmm.
and I make that shift. And
Okay.
then after that connection, then I'll switch to the next connection.
Mm-hmm.
If I start shifting, that mentally this is the time zone
Yeah.
that I'm in, and it
Yep.
makes a difference. Stay hydrated,
Right.
and as best as you can, sleep on the plane, especially if you can
Sure.
start sleeping in the nighttime thing with the melatonin, the herbals, even with some medication if you need to help you sleep.
Right.
And these things shift, they shift their circadian
Yeah.
clock, make it easier.
Also, I think their eating patterns will influence that. So I am told that one of the most important things is when, I'm going to be arriving at like 5 a.m. in my destination. So the sun will be coming up. And my temptation after such a long flight will be to go immediately to my hotel room and flop into bed, and just sleep it off. But they say that that's not the way to go, that you should get sunlight in your eyes, that you should adjust to the day. And as exhausted as you might be that first couple of days, that you should try and have a normal activity pattern, even to some extent exercise pattern, because my general routine is I try to exercise in the morning. I don't know how great I'm going to feel to take like a, 10K run, but, uh, try to resume normalcy, to push yourself a little bit in the new time zone. Is that a good recipe?
I think it's an excellent recipe. I don't think I do a 10K, but be awake for a while. You can get an hour nap, set the alarm clock. Otherwise,
Hmm.
it'll become a 6 hour nap. You're going to
Yeah.
wake up at
Yeah.
9 p.m. and it's wide awake. So,
Yeah.
and then go back to sleep again. And it's, keep it easy the first day.
Yeah.
It used to be I traveled, like, 10 city, 9 lecture kind of a thing. Um, and I'd get there and I'd lecture the same day. And I give myself the courtesy of
Yeah.
keeping it a light day when I arrive.
And I think that there are changes, I think, in one's ability to adjust to time zones as one ages. I think it becomes your circadian uh, flexibility, plasticity, or circadian plasticity becomes less robust as you get older. So maybe a little harder
I
to
don't
do
buy
that.
that.
You don't
I
buy
don't
that?
buy that.
All right.
No,
So you're not going to give up the ghost on that. All right. Good for you.
no.
Okay.
I think aging is a myth. I
Okay.
think there's certain changes, like the hormonal changes we
Mm-hmm.
talked about. But much of the rest of it has to do with lifestyle, has to do with state of mind, has to do with nutrition. I think that I intend to die very young. It's just very late in life.
Okay. Yeah.
I mean,
I'm all for that.
I,
It's like,
I feel 31. My wife is 27. I was born 73 years ago, but I figure I'm whatever age I feel, unless 31.
well, you and I are exactly the identical age, and I think you really embody a very good approach to the chronological aging. But I think you're not stuck on stereotypes about what aging means. So on a little bit less dramatic level, we're coming up to daylight savings time. Who knew? So early in the year, all of a sudden, another hour. But this is the bad one. This is like, it's fall back, spring forward, and spring forward means an hour less sleep. And for some people, that's not much. That's like a trip to Chicago from New York, but it's disruptive for some people. So you got tips for people this upcoming weekend?
Yep. Again, pamper yourself a little bit. And daylight savings time is an anachronism that should be repealed. We really don't need it anymore.
Right.
It causes 6 to 10% increase associated with 6 to 10% increased risk of auto accidents and even deaths from that in that
Heart
month.
attacks and emergency. I'd hate to be in the
Heart
emergency
attacks.
room on Monday morning. That state,
Yep.
that would be bad. I mean,
So
being on duty right after the time change, you're going to see a lot of mayhem.
yeah, so you want to go ahead and keep your sleep routine. You want to make sure that it's good. Again, get some good dark curtains, or better yet, if it's still light outside near bedtime, use the eye mask. The mask, it's dark as far as your brain is concerned. Do the things for sleep, the EP120 sustained release 10 milligram melatonin, 60 minutes before, 60 to 90 minutes before bedtime. Revitalizing sleep formula before bedtime. Epsom salt bath, especially if you have pain or anxiety, the hour before bedtime. And just make sure you enforce keeping that routine and getting to the bed and getting the full, 8 hours sleep a night. You're going to feel a lot better for it. And just be gentle with yourself that week.
Good stuff. All right. Once again, give us out the resources. Endfatigue.com is the website.
My supplement website is endfatigue.com. Information website is vitality101.com. And my email address is fatiguedoc@gmail.com.
And your new book is ready for pre-order, the pain book?
It should be up on Amazon within it'll be up by the 23rd.
Okay.
I'm not sure when they'll have the pre-order available, but it's called Pain Relief. And it's really short, simple, and it will get you pain-free. It's not hard. I've been treating chronic pain for 50 years now with people. The problem is not lack of effective treatment. It's lack of effective physician education. And much, if not most of this, you can do on your own. You can get pain-free.
Fantastic. Well, that's, I think, a very helpful message, and we look forward to having you back on to talk about that subject later this spring. So all the best to you, and thanks very much for joining us once again. Dr. Jacob Teitelbaum, one of my favorite experts that we tap frequently here on Intelligent Medicine. Thanks for joining us. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast.
I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant, and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com.